especially for a high value dentistry, like implants and cosmetic dentistry, and not insurance-based dentistry where patients just utilize their insurance, max it out and leave, you are basically running high ticket sales for treatment that's $5,000, $10,000, $20,000, sometimes even like $50,000. And imagine in any other dentistry, they're selling a product that's up to $50,000 and they're saying, hey, I don't have the time to listen to my sales calls. It doesn't make sense.
In this episode, I'm sitting down with Dr. Kris Bano to break down how he's built a standout fee-for-service practice in Southwest Michigan. And he walks us through how his entire team works together to create a smooth, high-touch experience that starts with the very first phone call and continues long after patients leave the chair. Kris shares how his love for art and cosmetic dentistry shaped his approach and what it really looked like to drop all insurance contracts so he could focus on personalized care instead of volume. And he gets into the actual systems behind it too, from intentional communication workflows and his unique triangle model for patient care, all the way to using smart technology for marketing and call tracking. So you're also going to hear his honest take on building a team around empathy and growth, how coaching has shaped their culture, and how he juggles being a practice owner, leader. You'll also hear his honest take on building a team around empathy and growth, how coaching has shaped their culture, and how he juggles being a practice owner, other business owners, leader, and so much more. He shows that you can have a practice that's profitable, patient-centered, and personally rewarding. So let's dive into how you can create a more patient-focused practice and a more balanced life using Kris's playbook. Kris, how's it going?
It's going well, Michael. How are you doing?
I'm doing pretty good. Thanks for asking. Kris, if we can start off by giving us a little bit of a practice snapshot. What kind of practice are you running today and what makes it truly different in how it operates or serves patients?
That's a good question, Michael. We're a general dentistry practice, Southwest Michigan. There are, I would say, 3.5 dentists at our office. It's myself and my partner. We have a full-time associate, and my partner's wife works a day and a half a week. Each of us does something different. So what we like to say is we've niched down. I've niched down in cosmetics and implant dentistry and more comprehensive dentistry. My partner has niched down in sleep TMD. Wife sees kids a day and a half a week. And then our full-time associate just does a mix of everything, bread and butter, some implants. She just takes the rest of the patients. How we're different is, one, we have a large team in a single location. So we're a team of 16, excluding the doctors, 5 front desk, hygiene and assistants. We're not volume-based. We're completely fee-for-service. We dropped insurance last December. So this has been our first full year without any insurance contracts. Everything is built around what we like to say is like high-touch communication. We're really, really focused on systems and communication and patient experience. And that's what I think sets us apart, aside from all the dentistry that we offer in-house. We like to focus on the human first experience and then the dentistry second.
Okay, interesting. Real quick, rewind a little bit. You niched down in cosmetic, you specifically. Why did you go that avenue?
Well, from dental school, I liked cosmetic dentistry. I liked the art behind cosmetics and changing patient smiles, transformations, confidence, all of that. So I really honed down on focusing on that craft through CE and hours and education and learning. From there, it just grew and grew. And the way I kind of got into implants is because I wanted to change smiles. And I also enjoyed surgery. I just mixed both of them. Let me transform smiles, but let me do surgery as well.
I like that. And so you have a staff 16 right now. I mean, we're going to dive a little bit deeper on that whole part about like how that kind of came out to be. But for right now, is it looking to grow or is it looking like, hey, it's established, we're great?
It's a good question. If we want to grow much more, we need to expand the building. We already have 6 assistants for 3 doctors, so 2 assistants per doctor. All of our rooms are full, like 9 treatment rooms. So we only work, I would say, 3.5 days a week, so 32 hours for our entire team. The only way we can physically grow, at least staff-wise, is by expanding the building, which we've debated, but we're kind of focusing on maximizing what we already have because there's also so much to maximize in our current office, our current staff, our current systems, the dentistry that we're doing. There's so much more we can do without just physically growing the team.
Mm-hmm.
But if you're getting at like multiple practice locations, I don't know if we want to dive into that. We're really lifestyle focused too. At least right now, it's not part of our vision, but who knows what happens down the road.
Yeah, that's interesting because you have another doctor, the wife, and another doctor, right? So kind of like four. Whenever there's like choices that you want to present, how is like the camaraderie or how is like the team dynamic and everything with you, the doctors?
So we all work very well. So I bought into the practice 50% with
Mm.
the other doctor, Dr. Chad. Even before that, when I was an associate, I was very independent. He is the type of person that he trusts the individuals that he's working with, and he trusted me. Any decisions that I made, even as an associate, I had that complete control. Now, as we're partners and the two associates, we all just jive well together. Any decisions or anything that they want to implement, we just talk about it. If it makes sense, then we'll do it. Really, we haven't had any disagreements, arguments, or anything like that.
Yeah. No, that's really good. You mentioned buy into the practice. There's been times, Chris, where like that's the goal. We want to buy into the practice, but then we get duped or something happens, right? Bad signs, bad things. So for you, like what are some good things where you're like, you know what? He's been true to his word, or this has been great. We're going to continue and I want to sign on. Or maybe what were some things that might have caused you to say, like, I don't think I want to sign on to this?
First of all, I evaluated that it was like a relationship with Chad. Even as an associate, I had complete independence. On top of that, I've been working there for 4 years. So I got to know Chad. We were friends outside of the office. On top of that, we weren't stepping in each other's toes, so to say, for dentistry. He enjoyed his niche, sleep TMD, and new patients. And I enjoyed doing the rest of dentistry. So we weren't doing the exact same thing. And then we partnered up and we're like, hey, you're taking my patients, I'm taking your patients.
Mhm.
And our personalities are very similar, but also different. And we both work well together. That's what I would recommend. If you're going to partner with anyone, make sure you're there for a few years. You understand the office. You have a good relationship with that person, similar to like a marriage. I mean, it's going to be a business marriage, business partnership. And you both ideally complement each other's skill sets. That's very important.
I like that. Thank you for that. So then if we followed a new patient, because you were talking about high touch communication and systems that you guys really, really dive into. And it's interesting that you guys are completely fee for service now too, because I feel like all this has to shine much more, but very differently too, in a way where we feel like I want to go to you. So if we followed a new patient from the first call to their first visit, what would stand out as unique?
Great question. Like you said, when you're fee for service, you even have to be more on top of intake and office systems and the office experience. It's not just about insurance. And in fact, we rarely talk about insurance now. Obviously, it comes up because a lot of patients have questions, but we try to put insurance at the bottom of the list. What matters more is the patient, their health, and the office experience. So our team is the most important, and our systems through communication and that first phone call. I really, truly believe that first phone call sets the tone for every new patient exam that comes in the office and any consultation if you're doing specialty procedures. So we spend a lot of time on that new patient phone call, training, listening to phone calls. What can we do better? What language are we using? How are we screening these patients? And then from that new patient phone call, they come into the office. They see the exact same person they've talked to. So that's very important. That's not outsourced because some offices use VAs, for example. And then we have our treatment coordinators. We split the front desk into intake, front desk, and then treatment coordinators. Treatment coordinators, let's say it's a new patient. They come into the office, they get greeted, they sit in the waiting room. And then the treatment coordinators take the patient, they bring them back into their office. When they bring them back, that's where they have that 5-minute conversation with the patient. What brings you here? What our office is about? What are you looking for? Basically, they just get to know the patient and build that rapport in person. From there, they walk them back to the assistant. They do what we call our triangle. Always 3 people, the patient, treatment coordinator, assistant. Treatment coordinator is relaying all the information to the assistant. So the assistant is very well prepared for this patient. And then they have talking points they can talk about right away. The assistant goes through the flow. Another triangle occurs when they meet the doctor. Assistant, doctor, patient. Another summary. That summary prepares the doctor for what to talk about and who this patient is. And then we run through the experience. Let's say we go through the dentistry part, the diagnosing, again, another report that's being built with the dentist, with the doctor. And then the treatment coordinator comes back again. And we have another triangle. Patient, treatment coordinator, doctor, and then the assistant's on the side. So those 3, the doctor then summarizes what was talked about in the visit with the patient, their main goals, what treatment was discussed, And then the treatment coordinator brings them back to the office where they started, where they were comfortable at, behind closed doors, and then presents the treatment options. So it's a whole experience from beginning to the end, and we don't rush through it. We've gotten efficient at doing it, and each of the steps are well thought out, but we don't rush through the experience because it's very important that you don't make it feel like a factory.
Interesting. Okay, I like that. The triangle. For someone coming on that's brand new, right? The training process for them with the triangle, is it something that they need to, you know what I mean? Like, okay, here's your systems, here's your profile and everything like that, and then we're going to have to do it all. And then you have like a month to get on board, or is it more so like just super easy to train?
So first we hire for personality, right? So we hire for energy, communication, empathy, all the skills that you're looking for in that position that you want to hire. And then if they have those personality traits, those foundational skills, then you can train our systems. And all the skills are just teachable, but obviously the personality isn't that teachable. So we really focus on whatever role we're hiring for, whether it's front desk, assistants, hygienists, the personality is very, very important. Make sure they fit with the office. Then how we go through the flow is we just recently hired 2 new assistants, for example. We have them shadow our front desk, our assistants, our hygiene for a whole month. We have them do procedures on their own throughout that whole month, some basic procedures or some basic limited exams, for example. We even throw them into a new patient experience, but we have them shadow. And then on top of that, we have them be the patient. So they go through the office as if they were the patient through a new patient experience. So they get to see all of those touch points and how they're done and how they're done well and what they need to do.
Yeah, they have to go through it. So then how do you track where the first interaction comes from, and how accurate do you think your assumptions were before you started using data tools?
So now we use CallRail. The reason we use CallRail is, like you said, we wanted to track where our patients were coming from. And we actually run a marketing agency. So I've been running a marketing agency for 3 years with a partner. We started it in our office, and it's implant focused, like comprehensive full mouth implants, cosmetic focused marketing. And it was a crucial tool that we needed for marketing because, one, we wanted to track what kind of campaigns were working, especially because we also run general marketing. So we wanted to see what numbers were being called. Was it the general campaigns that were being called and where these patients were coming from? Was it implants? Was it Invisalign? So that was one way that we track patients through CallRail. We break up the numbers. Where are these patients coming from? On top of that, are they new patients? Are they existing patients? Or is it something else? We filtered them through that. And then third, we also tag these patients. So they're having a phone call. They're talking about implants. CallRail tags them that they're talking about implants. And then we review this weekly. So we get to see, hey, how many phone calls were had about implants? How many were had about Invisalign? We look into the numbers and then we look into the campaigns and see what's working, what's not working.
Interesting. Okay. I like that. How long have you been utilizing CallRail?
For a year now. Before that, we knew the campaigns were working because we could see the numbers on the back end. But with CallRail, we have much more data. And then we also have recordings, which is super helpful too.
Yeah. How have call recordings or analytics helped you confirm your team is communicating that vision clearly?
Yeah, so that's another great question because, like I said, we run marketing. We run a marketing agency on top of dentistry. We have other offices that we do marketing for. And we've noticed phone calls are the biggest miss in terms of quality of phone calls. A lot of dentists don't pay any attention to phone calls. If you think about it, it's a little bit backwards, right? You're running this business, your first front door to your office is your phone call. And then you listen to these phone calls and you're like, what the hell's going on? The quality of these phone calls is horrible. Then when you think about it, you're like, hey, I haven't done any intentional training on phone calls because I have never listened to them. So that's what we figured out. The listening to recordings is super helpful for practice and for training. So breaking down phone calls. We break down how to run an ideal phone call. I listen to phone calls from my office and other offices. What did they do well? What could they have done better? Did they touch on the framework that we recommend? So listening to phone calls as a dentist is a must. Like you need to know how your staff is communicating on the phone.
This is where so many practices are quietly leaking money. Kris mentioned that most dentists have no idea what's actually happening on their phones. They're spending on marketing, leads are coming in, but no one's listening to calls. No one's tracking which campaigns are working. And then we blame bad marketing instead of looking at the front door. And that's exactly why I'm such a huge fan of CallRail. And it's why we've partnered with them on this episode. CallRail basically turns your phones into a clean dashboard. It shows you which marketing source a call came from, like Google, Facebook, mailers, website, ground marketing, whatever. It records the conversation so you can actually coach your team instead of just guessing. And it helps you see in black and white which campaigns are bringing in real treatment opportunities and which ones are just burning cash. And here's the fun part. A lot of people don't have a marketing problem. They have a call handling problem. And when you start listening to those recordings, you'll hear exactly where patients are excited, where they're confused, and where the ball gets dropped. And CallRail even provides suggestions and coaching in the recording. So it's fantastic. If you've ever wondered, are my phones actually converting or are we just busy? This is the tool that answers that question. You can check it out at callrail.com/dental marketer. That's callrail.com/dental marketer. That link lets them know you came from the podcast and gets you plugged into their dental focus setup. So it's just for you. Also, you get 14 days completely for free. So go to callrail.com/dental marketer, or you can go in the show notes below and click on the first link in the show notes below, and it'll take you to the website and you'll get your 14 days for free as well to check it out and see what it can do for you. All right, let's jump back in with Kris and keep digging into how he built this high-touch fee-for-service model. Yeah. So there's two things sometimes, Kris, with that. So sometimes like we want to, but do we have the time kind of a thing? And you're just like, oh man, I'm trying. And then the second thing is like, what am I really looking for? Like I get the tone sometimes, but then at the same time, is it the staff dropping the ball or maybe the patient just really is just shopping around, or what would make it better? And what have you noticed that made it better for common areas?
So the time, I think, is an excuse. If you're a business owner, you need to make the time to listen to where your clients are coming from, because that's going to feed your dentistry. If you don't have the time to listen to phone calls of your, so to say, your sales team, and you're the sales manager, you're the dentist, you're managing your intake of patients, clients that are coming in, you need to make the time. On top of that, you don't need like a background in sales, so to say, to understand if a phone call is good or it's not good. But what I tell offices, and even our office, we need to, especially for high value dentistry, like implants and cosmetic dentistry, and not insurance-based dentistry where patients just utilize their insurance, max it out and leave. You are basically running high ticket sales for treatment that's $5,000, $10,000, $20,000, sometimes even like $50,000. And imagine in any other dentistry, they're selling a product that's up to $50,000 and they're saying, hey, I don't have the time to listen to my sales calls. It doesn't make sense. Like you need to hone that in. You need to be on top of everything from the intake.
Sharpen it. I like that a lot on changing that mindset. So with that being said, when it comes to implants, anything specific that you look for that CallRail even helps you with?
We get to see how our campaigns are doing, like how many implant calls we're getting, because we have attached a number to our implant campaign. So like I said, we track the numbers. So we have like 5, 6 different numbers for general, Invisalign, implants, cosmetic. So that's one way. Another way is we tag the calls. So then we also see how many patients are talking about implants. And then third, we listen to the recordings for implant conversations.
Gotcha. When they do call for implants, anything specific like that you guys, because you mentioned you have like a framework on how to get them down. So like anything that we can utilize for that?
No one really truly cares about single tooth implants unless it's a front tooth. So let's say they call regarding our implant campaigns for like full mouth implants, because full mouth implants, it's much more emotionally tied. In that case, you can't run it like a general dentistry phone call. You need to, one, obviously introduce yourself. You'd be surprised how many offices don't even get the patient's name within like the first 3 minutes, let alone like the first 10 seconds. They don't even introduce their office or even know who this patient is that's calling. But aside from that, aside from the basics, introducing yourself in the office, you need to build rapport and that connection with the patient. They're going to probably call asking about pricing. So pricing is talked about at the end. Value needs to be communicated first before you talk about price. And they need to make sure that they trust you, and you need to learn who this patient is. So building that rapport, who this patient is, why they called, what they're suffering with, and then how can you help them? Most importantly, how can you help them? So when you tie their emotional goals and what they're suffering with to what you can offer, and then you schedule them and get commitment. It's very basic. It's like 4 steps: connect, pain points, how can you help, schedule. But so many offices don't do this.
Interesting. How do you handle the question like, do you take my insurance?
For just general,
Yeah, for anybody.
the way that we handle it is we take all insurances. We don't partner or contract with insurances. And we will utilize your insurance benefits. We'll maximize them. And how you get paid is how it differs. So instead of you not paying everything up front, we do a little bit backwards. You pay for the treatment up front. We estimate what your insurance is going to reimburse you, and then they pay you directly. So that's how we kind of handle that question. We still use their insurances. We use everyone's insurances to the maximum that we can. We're not tied to insurances.
Interesting.
We don't let the insurances dictate your health decisions, pretty much.
Yeah. When you dropped insurance, did you kind of like convey this message to your existing patients in like more of a simple way that they understand, but not revealing too much kind of a thing?
My advice is if you're going to drop insurances, it needs to be a multi-month process. Like we dropped it in end of December and we started in July. So we prepared videos, prepared letters. So we try to make it a little bit personal. Aside from just sending them a letter, hey, we're out of your insurance, good luck. We sent multiple letters to different patients and different insurances that patients had. And then we also had general videos of us talking about why we're leaving insurance and what that means for you. And that's what I would recommend.
I like that. The videos. It's really helpful. So then what data helped you discover what actually resonated? Whether it was like reviews, conversion analytics, or call tracking. I know call tracking you mentioned a little bit, but with everything else, what were you looking at where it's like, this is sticking, or hey, we thought this would stick, but it's not?
So what we realized was, again, it's going back to the team. From reviews and phone call recordings, we realized patients are coming in because of the conversations and for the team and not necessarily for the dentistry or the dentist, honestly. So if you look at our like most recent reviews, they all mention the team, the warmth of the team, the conversations that were had from the team, the phone calls, when we were listening to them, they made that connection with that team member. It had nothing to do with the doctor or the dentist. So that's why it's super, super important, especially if you're going to go fee for service. You need to work on your systems and your team.
Gotcha. You mentioned that. Is there like a specific workflow or system that gives you a clear operational edge?
I wouldn't say there's one. There's multiple things that we do. If you're going to implement anything, make sure you're intentional about doing it and make sure you're consistent. We have monthly meetings at the beginning of the month, but also once a month Thursday meetings. And each of those meetings are structured differently to work on different things. On top of that, we have proven processes, as we like to call them, like 1, 2, 3, 4, 5, 6, 7 from intake, for example. In addition to that, we also do morning huddles and end of day huddles. So we're very intentional about that. Morning huddles are looking 1 week out in the schedule and they're looking the day of, the morning of, making sure we're prepared. End of day huddles, we wrap up everything. But what was talked about in every single column, we make sure everything was wrapped up and the day is sealed for any tasks that we need to do. So we're just very intentional about it.
Yeah. End of day huddles every day?
Yes.
Oh, wow. Interesting. And then your Thursday meetings, that's more like a big meeting, or is it more so like, hey, we're just going to discuss some things that went wrong, some things that went right, kind of a thing?
So Thursday meetings are once a month. The way that we have pivoted for Thursday meetings is they're more practice and training focused. As we like to tell our team, dentists are playing like 4 or 5 days a week, however many days that you work, but we're not practicing. Imagine a sports team that's just playing games, but they don't get any practice time. So that's why we have these meetings, because we need to be intentional about setting aside practice time. So on Thursdays, we break out front desk. We as the doctors come with an agenda of what we recommend to do for that day. But we break out front desk works on either follow-ups, organizing our patient tracking, being prepared for the next week's consults and new patients, or any other tasks they need to do. Clinical, we work on specific tasks as well, making sure our surgeries are organized for the following week, make sure we're prepared for specific patients. If we need to practice any scanning techniques, any workflows, every week is different. Content creation, if we're filming any videos for social media or for patient education, that also happens on Thursdays. Every month is different, but we focus based on the team.
Okay. How much does CallRail help with the design of these meetings?
So CallRail, we get to see where the patients are coming from and how they're broken down into dentistry niches and call recordings. So with call recordings for front desk, for example, in this meeting that's coming up in about 2 weeks, I'm going to go over how to use call recordings for self-analysis for your sales skills. So I've made like a template of what to talk about and how to self-analyze yourself listening to your call recordings. And that would be great for the front desk. And that's one way you can utilize CallRail, for example.
Yeah, I like that, self-analyzing it. So then let's talk about your team. When hiring, how do you filter for people who help the practice grow versus like they're just trying to fill a role?
We hire for the person. We don't necessarily hire to have them grow the practice. We know if we hire the right person that we need for that specific role, they're going to grow the practice because we hired the right person with the right energy, communication, empathy, for example, and we've trained them on our systems. Naturally, they're going to make the practice grow. And then we also have incentives as part of the practice.
We've been discussing that quite a bit lately, the incentives. How do you structure that?
So we have a bonus system and it's team-wide, just making sure there isn't drama and making sure it's fair. So the way that we do it is we have a minimum threshold or what we call our break even to cover all operating expenses, salaries, all overhead pretty much. Anything above that, 15% of that gets divided between all team members. For example, just to kind of throw some numbers out there, let's say your break even is $100,000 to make it simple. Let's say for the month you did $150,000, $50,000, 15% of that, let's say $7,500 is divided between all of your team. And that happens every single month. That break even doesn't constantly change. Maybe we change it once a year. I know some dentists implement incentives, but then they're constantly raising their floor. I wouldn't recommend that. You're going to get a lot of pushback, a lot of frustration with that. Figure out your break even. If you want to do this bonus system, fine, you can do it. But you need some kind of incentive, especially if you're fee for service or you're doing more non-insurance based dentistry, because your staff needs to be incentivized to be on top of everything.
Gotcha. So that's the accountability system you would say that they have is the incentives?
Accountability comes from us, but also their own internal motivation. I would say the incentives play into it because they're like, hey, if I do a good job on these phone calls, if I self-analyze my sales skills, my phone calls, if I do better, more patients are going to come in. We can help more patients. If we help more patients, we collect more. I'm going to make more money than my salary.
Team of 16 is huge. So like, have you ever had to kind of, when it comes to bringing in new people, you just kind of see some people don't mesh. You're on the right bus, but you're on the wrong seat kind of a thing. And still it didn't work out?
I mean, it's definitely happened. I wouldn't say it's common. I would say the past 4 years, we really minimized that happening. As my partner, Chad, because he's been in the office for 13 years now, 12 years. From the beginning to now, a lot has changed and he's gone through a lot of those experiences. So that would probably be a better question for him because in the past 4 years when I've came into the office, we've had a few assistants that weren't the right fit. But other than that, it's been pretty smooth sailing because we've been so intentional about who we hire.
Nice. Awesome, man. That's really good. So then if we could dive into your marketing and how you approach it for the practice, which marketing campaign right now surprised you the most in terms of ROI or effectiveness?
Like I said, we've been running our own marketing for 3 years. Implant marketing has had the highest ROI. It took 9 months to dial in. But once we dialed in, once the systems were in place, implant marketing has been the highest ROI.
Gotcha. Did the data ever contradict your gut? Like an ad you thought was going to fail, but was actually driving high value calls?
Not necessarily. We're always on top of the ads. We're on top of the campaigns. We're on top of the videos that we release as part of the campaigns, Google campaigns, all of it. You get to track and we see what's working and what's not working, especially now with CallRail. We look at a lot of different metrics and there aren't any ads that kind of surprise us or don't surprise us. There's like some ads, like video ads that have surprised us. Like, oh, wow, this works really well. In a way, we're intentional about how we make these ads. So we're not too surprised that they work.
Gotcha. Anything specific in an ad or a platform where you're like, these work best on this type of platform as far as like social media?
Facebook and Instagram. What a lot of dentists are missing on is video ads. They run video ads, some offices, but they're very generic. They're like a tour of the office, a fly through of the office with some kind of voiceover. But if you run like more talking head video ads, like think about TikTok, for example. You're scrolling through TikTok, you hear somebody talk about a random topic and that interests you. Those type of ads for dentistry seem to work really well. They're much more authentic.
Yeah. Talking heads. And it's interesting. That's true. I like that. So then when it comes to this, like how are you attributing success across your marketing channels today? Are you using only call rail, or is there other specific metrics that you're looking at besides call tracking, form tracking, or other analytics?
So definitely call rail to see our breakdown and the volume of calls. And then through the platforms themselves, Google and Facebook, we get to see all the numbers. So we see the cost per lead, we see the click rate, we see the click-through percentages, all of the data we get to see on the platform itself. So then we get to see which ads are working, which aren't working.
Do you recommend, Kris, like a practice owner gets super familiar with all this? Hey, get familiar with your analytics on your website, your conversion rate and all that? Or it's more like, when you can, outsource this?
That's a great question. I don't recommend practice owners to do it unless they love it.
Mm-hmm.
Just fell into it and we wanted to build this system because we tried other agencies and we weren't too happy with them. But if I can give any advice on marketing, is it's not the marketing, it's your office. You can run the best marketing with like the best agency. Let's say we come into your office, we run your marketing. We know it works super well because it's worked in our office and many other offices. But if your office isn't in order and it's a mess, you don't have the right systems, you don't have the right team, the right front desk intake and communication, marketing isn't going to work. So there's no point in focusing on the numbers and all those details if your phone calls suck, for example.
Mm-hmm.
If your house isn't in order, it's not worth bringing people into your home. So you need to fix your home first before you can bring in these people and look at the numbers.
So then what's the first thing you recommend? Someone listening right now and we're like, okay, I got to check if my house is in order. Step one, what's the first thing I can check that could be like glaring obviously to me where it's like, oh, maybe it's not.
So step one, do you have like an intake process from beginning to the end? Kind of like how I talked about in the beginning, how we have this flow from the triangles to the communication to the handoffs to the phone call. Like, do you have that or do you not have that? Mm-hmm. Second, listen to the phone calls. So listen to the quality of the phone calls. A phone call, if you were buying a $30,000 cosmetic treatment, would you be comfortable with that phone call? Imagine you were a patient. Would you trust this person or this office if they were having that phone call with you? I would say those two things. And then there are so many other things. I would say invest in specific coaching, and we've gotten into that. But if you see a dentist that's doing what you want to do and you see them succeeding and they're doing well, learn from them. Especially if you don't have all the answers and you can't implement from the beginning and you don't know what to implement, find somebody that's doing what you want to do and just ask them if they can help you.
I like that. Any specific coach that comes to mind for you where you're like, man, this really like pivoted or changed our trajectory a little bit or a lot?
Yeah, so we started with a guy named Scott Manning, and that's where my partner, Chad, he started with Scott, and we implemented all of his systems, and we're still working with him. It's been 5 years now. Every single year we've been working with him, and he's one of my mentors too. And then from there, what we did was we created our own coaching platform to make it a little bit unique because we wanted to utilize our strengths, myself, Chad, and my other partner. And we're working dentists that are doing what other dentists would ideally want to do. And we're not just somebody that's telling them what to do or that is a business person and just telling them, hey, focus on these numbers, do more hygiene, do more this. We're like, hey, there's much more to it. And you're going to come in our office and you're going to see how we run everything as part of our coaching. We are implementing what you want to implement, and you're going to learn from us directly in each aspects from business, clinical, financial, all of it.
Gotcha. I like that. Yeah, Scott's a great guy. So then with that, coaching, Scott's one of the ones. What about external company that supported you? What would you say has been one of the best ones? And then one of the ones that just didn't really vibe with you guys?
To be honest, we've used a few marketing agencies. Like I said, that's why we started marketing on our own and how we started our agency. I don't want to name them by name, but there are a lot of marketing agencies out there. Even if your house is in order, they're either too big because they have so many clients, they're not going to focus on your results, or they're just doing the bare minimum. And you need to be aware of those marketing agencies. It's hard to be aware unless you've maybe gotten advice from other dentists or you've been burned before. But if you're going to start marketing, even if, like I said, your house is in order, your systems are in order, just make sure to really vet who you're working with.
Gotcha. And then the best company you've worked with so far?
Best company, Scott.
Scott. Okay. Yeah. Gotcha. As a coach. So then what's a painful mistake or failure that taught you something essential about running your practice?
In the beginning, spending a lot on marketing when we really didn't have everything dialed in. And I don't regret any mistakes or anything that didn't go as it should have gone in the moment because we've learned from it. And that's how we grew. But we realized what our mistake was. We realized it was us and not just the marketing. So I would say that was probably one painful mistake. Just don't spend a ton on marketing if you don't have everything else on order because you're going to be burning a lot of money.
Yeah. Did you realize that once you started listening to your calls and got call rail and everything, or was it more so
Yes.
Okay.
I mean, the marketing was working, leads were coming in, and we're like, oh, why aren't these converting? Or why are these leads not turning into consults? Or they're turning into consults, but they're not well screened or prepared or whatever excuse. And then we listen to phone calls, and we're like, hey, a lot of these phone calls and how we're screening these patients and taking them in aren't done well.
Gotcha. Why did you guys decide to go with call rail?
I feel it's probably one of the most comprehensive integrations for marketing. I'm sure it is. Maybe it's utilized outside of dentistry, but within dentistry, I think it's the most comprehensive, the simplest to use. It has all the features that we want. That's why.
Gotcha. Interesting. So then when you're looking at your reports and everything like that, what tells you man, we're on a good trajectory. Our momentum is picking up. What metrics tell you your practice is healthy and not just busy?
What revenue is coming in for that month? That's the final sign, right? I mean, you could look at new patient exams, consults that are coming in, all of those numbers, and those definitely play a role and a big factor. But at the end of the day, you need to look at your collections. So what are your total collections for the month? If they were high, okay, what did we do well? Why were they high? If they were low, okay, what do we need to work on? Were we low on new patient exams? Did we have a lot of new patient exams, but not many of them converted into treatment? Why didn't they convert into treatment? So there's a lot that you can almost work backwards from that final collections number.
Reverse engineer it kind of a thing.
Yeah.
Interesting. Are there any specific numbers besides revenue that you're really proud of right now?
I would say consults that we're getting weekly, new patient exams getting, those are feeding the numbers, of course. So you need to make sure that's consistent. How is that going to be consistent? Make sure your campaigns are well optimized and they're doing well. Make sure your team's in order to greatly utilize those leads. Make sure you're tracking where those leads are coming from. Call rail, for example. Make sure you're listening to phone calls. All those steps play into the numbers that are coming in and then the final number, the collections.
Gotcha. Kris, you do coaching, you have an agency, and you're a practice owner. How's your personal life? How do you balance this?
So I get that question a lot. One is I don't have kids. That plays into it. We don't have kids yet, so we have much more time. Two, we were intentional about our hours on the clinical side. So like I said, we work 33 hours a week. So Thursdays, we're having this podcast on a Thursday. I'm at home. I'm working on marketing and coaching. Fridays, unless I'm doing a large cosmetic case or a surgery, we don't go in on Fridays. Or if I want to film specific videos. But even the videos are for marketing or coaching. And then we have Saturdays and Sundays too. So there's a lot of time if you structure your clinical weeks well and you optimize your clinical weeks, you optimize your team to then make sure you get the most out of those days, especially if you're cutting days back.
Correct me if I'm wrong, Kris, but I'd be a little scared, saying, man, I want to cut back days and then cut out my insurance. You know what I mean? So what would be because that sounds like a dream, to be honest. Man, 3 days and then just no insurance and then just being focused on, I think that's what a majority of practice owners want. But is that really realistic for everybody, or what are your thoughts?
It is realistic if you want to make it part of your life and that's your vision. The caveat is it didn't happen all at once for us. We didn't cut hours and cut insurance at the same time. We cut our hours in the beginning and Dr. Chad did this. He had that schedule before I even came in. We switched some hours around, but we were at the 32 hours before I came in. And the staff loves that. And there's a lot of blank spaces or non-busy work that dentists are doing, and they're spreading over 5 days that they can do in 3 or 3.5 days. So that's one thing they need to take a look at. And maybe you can get some help from somebody that's already done it. For example, like I said, coaching. 2, once your days are dialed in and your systems are optimized and everything is going well, then you can think about, hey, do we drop off the last remaining insurances? And that's what we did. We were in contract with one final insurance. Everything was in order. We worked on our team, our systems. There's obviously so much to work on still, but then we dropped insurance. Long story short, it didn't all happen at once. You shouldn't make it all happen at once, but it also needs to be a part of your vision. If it is, and you're intentional about it and you're consistent and putting in the work, you're going to make it happen.
Do you think sometimes we feel like we want it we get that momentum and we get that motivation, and then that dies fast. And then you're just kind of like, I'm drowning now. I'm suffering. I'm just going to go back to taking a little bit more or opening up another day on Saturday. And
Yeah.
we kind of do that a little bit more.
We do that, but there's probably more underneath that why you're lacking the motivation or why you're going back to more suffering in a way, right? Why do you want to go back to working more and being more stressed? Very likely you haven't set out a vision for yourself. What do I actually want? What do I want in 5 to 10 years for my life? If I keep doing what I'm doing, am I going to be fulfilled for the next 5 to 10 years? Or am I going to be miserable or am I going to be burnt out? So map out what you actually want in life. And then, like I said, reverse engineer that. And if you do that, if you have a vision to use as your foundation, obviously not everything's going to go to plan every single step, but at least you know what you're working towards. And you're not just flying blind. 1 week you're working more, 1 week you're working less. You don't know who to hire, or you're hiring people, you don't know exactly what they're for. You just need to map out everything and be very intentional.
That's really wise. Man, thank you. Kris, some of the last questions we want to ask are just to get inside the mind of you a little bit more. One of them is time travel. So if you can go back in time and give your starting out self one piece of advice, but it cannot be business related, what would it be?
I think this ties into what I've been talking about, consistency and being intentional. So looking back in my life, I don't regret everything because it's led me to this point. I'm very fulfilled where I'm at. I obviously still want to grow, but the more consistent you can be in whatever you're doing and being very intentional about it, like you said, not flip-flopping hours, for example, being busy and not being busy or whatever it is. If you're consistent and you implement and you're intentional and don't rush the process, don't think you need to do everything all at once. That's the advice that I would give my younger self. Just stop dropping off things. Just be consistent and be intentional.
I like that. Be consistent. Nice. And then the philosophical investor. If you can invest in one currency that's not monetary, like kindness, integrity, empathy, which would you choose to enrich your business and why?
I would say trust. Trust is everything in dentistry, especially if you're not playing the Medicaid or PPO insurance-based game. If patients trust you, every other part of the business becomes easier. And if you think about it, the patients that you've done the most work on, they trust you. And it has nothing to do with you explaining the fancy steps of the procedure or your degrees or your letters behind your name. It's because they trust you as a human. Like me, for example, right? Like if you had treatment that you need to do on your mom and you told her, like, I'm going to do X, Y, Z, you don't need to give her any details. Your mom trusts you and she's going to do the treatment. It all comes down to trust.
I like that. I like that a lot, Kris. Thank you so much for being with us. It's been a pleasure. But before we say goodbye, can you tell our listeners where they can find you?
So I am on Instagram, KB Dentistry. Also on YouTube, Dr. Kris Bano with a K, Kris. Also on TikTok, Dr. Kris Bano. Just look up Kris Bano. You'll probably find one of the pages.
Nice. Awesome. So that's all going to be in the show notes below. And Kris, thank you so much for being with us. It's been a pleasure, and we'll hear from you soon.
Thank you very much, Michael. It was great speaking with you.
Before we wrap up, notice that Kris, he's got this tight, high-touch intake process. He's fee-for-service. He's doing big implant and cosmetic cases, but none of that works if those first phone calls are sloppy or invisible. And that's where CallRail becomes kind of a cheat code. Imagine this. You can see exactly how many implant or cosmetic calls you get this week. You know which ads or pages actually generated those calls, and you can sit down once a week, hit play on a few recordings, and instantly hear, oh, here's where we keep losing them. Or, wow, when my front desk says this, people book on the spot. That's how you go from guessing to coaching, from we're busy to we're profitable. So if you've ever felt that gut sense of we're spending on marketing, but I don't really know what's working, head to callrail.com/dental marketer. Again, that's callrail.com/dental marketer, or you can go in the show notes below, click on the first link in the show notes below, and it'll take you there and start seeing what's actually happening on your phone. Get 14 days for free. You don't have to put in a credit card or anything like that. Just see what it can do for you for 14 days. And if you love what you see, continue with them and use that as a tool to coach and improve and get a ton more approvals in your practice. Thank you so much for listening to this episode. I truly appreciate you. Thank you for supporting the podcast, and I can't wait to talk to you in the next episode.